case you saw, I really was on the floor talking. You all know Mr. Schweikert? He has been such a partner with me in this.
I thought you were going to say caffeinated.
No. He has been such a good friend in all of this. And I know we're a little behind, so I'm going to get us back up to schedule. How we'll start is I'll just say a couple opening remarks. Let David talk a couple. I think then that's when the press will depart. We can all have some good conversations at work. I'm very excited with that CDC, NIH here, and a lot of others. For many of you know, you all know in this room the challenge of what valley fever has done and the lives it has cost us. The challenge to so many of our problems with valley fever also comes that it's just in a certain part of this country. And David, when he came to Congress, he and I were talking one day. I think I called him up and I said, you know, between your district and my district, it's probably about 75, 80%.
If you take my county, you take my county.
Counties, yeah, it's most of all the cases. He invited me out to the university, and we went there, toured a few places, came back, and I was meeting with the CDC, NIH, and I said, why don't we do a symposium in Bakersfield on valley fever? And many of you were there, and I thought this was a great first start. There were 3 goals that I laid out. First and foremost, awareness for everybody. You saved a few lives while we were at that one too, remarkable. At dinner afterwards. The best way to treat valley fever, and then the ultimate goal is to find a vaccine. We went and created a caucus after that to find ways that we could help from the federal government end to facilitate a lot of this, and a lot of people made more progress, and we've got the study going now. And so what I thought we could do is, many of you are going to be in town today, let's build off where we were before, let's get an update where we are, and I think one of the things I find by all the travel, the synergy of us communicating together to know exactly where everybody's at and what we need to finish the job.
Look, we've come a long ways. If you think where we were just, what, 5 years ago? You know, and I give the leader lots of credit for that because, let's face it, with his title and his passion, we've been able to, I think, do some good things. We've actually been able to encourage resources to go in directions where we've had some impact. If it's true, we're 3 to 5 years from an animal vaccine. Okay, I'm giddy about that. Help us understand if there's some creative, almost disruptive things we can do in the mechanism of then taking that vaccine technology and get it ready for humans. Is it some of the process? Is it the funding? Is it being able to do, I have a weird fixation on population statistics data as a baseline for medical trials. Is there ways we can get data off of lots of hospital servers and lots of places to cut down the timelines? Help us be creative to get that human vaccine done.
I know we were late, but did everybody introduce themselves around the room before we got here?
We talked about you.
Did you want to do that real quickly?
Can.
All right, go real quickly.
I'm Dr. Tom Schiller. I'm Chief of the Mycotic Diseases Branch at CDC.
Bryce Johnson, Medical Director of the Valley Fever Institute at Kern Medical.
Rob Purdy, I'm a board member of Valley Fever Americas Foundation. I'm a patient at the Valley Fever Institute, and I have cocci meningitis.
Dr. Bridget Barker, I'm an assistant professor at Northern Arizona University at Flagstaff.
Jack Edwards, I'm an emeritus professor from Harbor, UCLA.
John Galciani, University of Arizona, Valley Fever Center for Excellence Director.
Peter Pappas, I'm with the University of Alabama at Birmingham, and also the scientific leader of the MSG and the MSG Mycosis Study Group.
George Thompson, I'm an associate professor at UCSS.
Joshua Fira, I'm a professor at UCSC and also chief of infectious disease at the VA.
I'm Dr. Dennis Dixon, Chief of Bacteriology and Mycology, NIH and IID, and I've been to Bakersfield several times.
I'm Emily Arbeldi. I'm director of the Division of Microbiology and Infectious Diseases at the National Institute of Allergy and Infectious Diseases. And
I know we have others around if you want to introduce yourselves.
Sure, I'm Russell Jett. I'm the CEO at Kern Medical, the home of the Valley Fever Institute in Bakersfield.
Hi, I'm Ann Tatum. I'm with HHS. Sarah Silver with NIAID.
Melinda Haskins, NIAID.
David Schwaba, I'm a staffer for Congressman Rob Bishop.
Ian Llewellyn, I'm a staffer for Congressman Costa.
Sean Downey, CEO of NE.
JT Harrison, I'm with NE also.
Brendan Jackson with CDC.
Jeff Morrow with CDC.
We got a couple members just joining us, Mr. McCall.
Mike McCall, ranking member for the Affairs Committee.
Congressman Costa, appreciate the leadership Congressman McCarthy and Schweiker provided. This is an issue that's affected the Valley for many years, and you've been a tremendous champion in trying to bring support and attention to this very difficult issue.
Emily, you want to start?
Congressman McCarthy and other members of the Valley Fever Caucus, we're really thrilled to be here and hear about your longstanding interest in addressing the problem of Valley fever. So as I mentioned, I'm Dr. Amir Belding. I'm the director of the Division of Microbiology and Infectious Diseases at the National Institute of Allergy and Infectious Diseases. And we are NIH's lead institute for Valley fever research. I'm joined today by Dr. Dennis Dixon, and we're thrilled to be here to discuss NIAID research on Valley fever. We know Valley fever can be a devastating disease, and we know that many cases go undiagnosed. NIAID conducts and supports basic, translational, and clinical research to better characterize Valley fever symptoms and to develop products that will combat the public health challenge. So this includes rapid diagnostics, novel new treatments, and also vaccines. We were really pleased with the discussion that occurred over the past 2 days during the NIAID workshop on advancing the development of fungal vaccines. We think effective vaccines could be a groundbreaking tool to reduce the burden of fungal diseases, and that would include Valley fever. We're currently supporting scientists who are working on 2 promising vaccine candidates for Valley fever. A live attenuated vaccine that's developed using an avirulent strain of the pathogen, and then also a recombinant vaccine with an adjuvant. We recently issued at NIAID 2 funding opportunity announcements to encourage the development of rapid diagnostics and also novel approaches to prevent and treat Valley fever. And then also, we're supporting research to address key questions regarding the incidence of the disease and factors that contribute to the development of Valley fever and also the development of severe outcomes for these patients. So this includes our observational study, which recently opened in the Central Valley, sites in Bakersfield, and also in Arizona, both places where the occurrence of Valley fever is very, very high. So this study will enroll patients presenting with pneumonia. So thank you again for your continued support of NIAID's research in this area. And now I'm going to turn over to my colleague from the CDC, Dr. Thomas Chiller.
Great, thank you. Leader McCarthy, Representative Schweiker, members of Congress, thanks for inviting me. It's great to be with colleagues here. It's good to be back with you again and support these efforts in fungal disease. I'm Tom Chiller. I'm the chief of the Mycotic Diseases branch, the fungal disease branch at CDC in Atlanta. I'm the lead person who works on activities involving fungal infections in the US and globally. Fungal diseases continue to remain a significant problem in the US and globally, causing death and disability. They especially affect people with certain medical conditions, like those who are taking immunosuppressive drugs, those who have bone cancer, those who receive organ transplants, more of which is happening every day. Valley fever is one of these fungal infections. We often call this coccidioidomycosis, or cocci for short, so you don't have to say that mouthful. We often say cocci. It's common in the southwestern United States, but as you can see here from the map, it actually goes up into Washington. And so we've documented now a certain amount of spread up north as well. The majority of these infections occur in California and Arizona. We estimate somewhere around 300,000 are infected every year. But we found infections again occurring as far up north as Washington State and as far east as Utah. The true geographic range, therefore, of this infection is still being determined, and part of our role at CDC is to determine what I call geographic risk, because if you're not aware that the disease and the fungal infection exists in your area, you're not able to diagnose it or ask about it. So I think that's really one of our major responsibilities. You get valley fever by breathing in these fungal spores from the air. Obviously, we can't stop breathing, so it's really important to think about what other prevention type strategies we can do around that. Thankfully, not everyone who breathes it in gets sick. People who do get sick generally have a flu-like illness, and it can progress, obviously, to more severe disease, like our colleague Rob unfortunately had, and it can put people out for weeks to months to even years. In areas where valley fever is common, it's difficult to avoid this exposure to the fungus because it's in the environment. There's no vaccine yet, but I also am encouraged about the meetings today and yesterday talking about fungal vaccines. That's something that I haven't talked about much in my career, so it's exciting to see more information on that. Most people with valley fever, however, are probably never diagnosed. And because it resembles other common infections like the flu or like a bacterial pneumonia. Because of misdiagnosis, many patients end up getting quantities of medicines like antibacterials that they don't need. And so unfortunately, patients will come in, they will not be diagnosed, and they will be given different medicines and they will not improve, and that keeps bringing them back into healthcare. So that's a major issue for us because it contributes not only to these patients taking unnecessary antibiotics, but it also can contribute to antimicrobial resistance. So CDC works with a lot of stakeholders in this arena. We're thrilled to work with the Valley Fever Center for Excellence. We're thrilled that Dr. Royce Johnson here now has the Valley Fever Institute in Bakersfield, and we're thrilled to start working again with Royce on that. Our main partners, however, are local and state health departments, and there we work on improving surveillance for this disease. It's nationally notifiable disease, however, only 29 states actually report it to us. Because as you all know, states determine what they report and what they don't report. As the leader mentioned, awareness is so important in this disease, and we work really hard to talk about it, to make people aware, working both with healthcare providers and patients so they can be aware as well. And we really also help to work and facilitate research in this area. So again, thanks for allowing me a few words to speak, and it's really great to be here.
Well, thank you all. What we're going to do, we're going to go through a few different topics. We'll do public health, we'll do treating it, we'll do the therapies, and we'll go to vaccine development. But first, we're going to have the cameras depart, so you'll all be free. You won't have to be on script. You won't have to worry how you look. And as they do that, we've had